COVID-19 was declared a global pandemic by WHO in March 2020. Malaysia faced critical challenges from mid-March to end of April 2020, with a sharp rise in cases.
COVID-19 is an outbreak that the world had never experienced and had developed into a pandemic within a short time. Even until 18th of April 2020, this virus had been spreading fast, affecting a total of 12,64588 and have caused 14,6188 people to die.
The Malaysian government has implemented several measures to reduce the impact of COVID-19 and decrease mortality rates. During Prime Minister Tun Muhyiddin Yassin's address, he emphasized the importance of enforcing movement control orders, MCO, as a crucial measure to curtail the spread of the virus.
Dan untuk itu, kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan mulai 18 Mac 2020 iaitu lusa hingga 31 Mac 2020 di seluruh negara. Perintah kawalan ini dibuat di bawah Akta Pencegahan dan Pengawalan Penyakit Berjangkit 1988 dan Akta Polis 1967.
To contain the virus, Malaysia imposed the Movement Control Order, MCO, on March 18, 2020, shutting down non-essential businesses and restricting travel. These measures were crucial to mitigate the spread of the disease and prevent healthcare facilities from being overwhelmed.
The challenges: strain on healthcare infrastructure and resources. One of the most pressing challenges in the post-pandemic era is the strain on Malaysia's healthcare infrastructure. Hospitals were overwhelmed, and resources such as ventilators, personal protective equipment, PPE, and ICU beds were stretched thin. The pandemic exposed the limitations and vulnerabilities of the healthcare system, which struggled to cope with the surge in COVID-19 cases. Many non-COVID-19 medical procedures and treatments, such as elective surgeries, routine checkups, and chronic disease management were postponed during the pandemic. This has led to a significant backlog that the healthcare system must now address.
In response to the multifaceted challenges posed by the COVID-19 pandemic, the Malaysian government has implemented a series of strategic measures aimed at strengthening the healthcare system, improving resource allocation, and enhancing overall public health infrastructure. To address the strain caused by the pandemic, Malaysia expanded hospital capacities by establishing temporary facilities and converting existing structures. This included adding new ICU beds and upgrading existing ones to meet increased demand for critical care. Extensive procurement efforts ensured a steady supply of essential medical resources like ventilators and PPE through international collaborations, bolstering the healthcare system's response to the crisis.
In addition to physical health challenges, the pandemic has precipitated a significant mental health crisis in Malaysia. The extended periods of lockdown, social isolation, economic uncertainty, and the fear of the virus itself have taken a toll on the mental well-being of the population. These factors, directly stemming from the pandemic and its aftermath, have contributed to a noticeable increase in cases of anxiety, depression, and other mental health disorders.
Moreover, lockdowns interfered with routine mental health services, making harder for people to get the care they need. Due to economic difficulties, the healthcare system gave priorities on COVID-19 treatment and less focus on mental health treatment. In order to overcome that problem, the government used their power to implement a national mental health strategy in order to address the increased need for mental health services following pandemic by enacting and updating mental health laws to guarantee sufficient resources, protect patients' rights, and incorporate it into broader health